As Nigeria continues to vaccinate its citizens, the Presidential Task Force on COVID-19 has raised an alarm over the seizure of about 3,000 doses of fake COVID-19 vaccines that were en route to Africa from China. As a result of this, the Nigerian Customs Service has designated that all shipments of vaccines will only come through the Nnamdi Azikiwe International Airport, Abuja. This was contained in a statement by the Director of Department of Hospital Services at Adebimpe Adebiyi. The reports also revealed that some vaccines are already in circulation on the continent. This is already provoking ugly comments not soothing to the image of China in some quarters. And joining me to discuss this is a medical virologist, Kolawole Oladipo. Good to have you join us, Kolawole Oladipo. Talk to us about the implication of this for the vaccination program here in Nigeria and as well as Africa, and also the implication of taking a fake COVID-19 vaccine.
Yeah, thank you for having me on the program. The most important thing that people should know is that taking a vaccine that is not approved by the Nigerian government is very dangerous, very dangerous, because you don't know the consequence, you don't know if it's safe, you don't know if it is effective, and that is why the NAFDAC has recommended the appropriate vaccine for us to use. We all recollected that then before this one was approved, it was scrutinized and NAFDAC gave the approval. So we should be careful of taking any vaccine that has not been approved by the Nigerian government. Then another second thing we should take note of is that taking that vaccine will cause more damage to the pandemic than what we had before. And vaccine should be taken from appropriate designated places in order for us to end the pandemic.
So there are cases where people are reusing empty vaccine vials, and that's one case. But there is also another case where original vaccines were diverted and then reintroduced into the supply chain without any guarantee that the cold chain has been maintained. How do we deal with this in the face of inconsistent availability of these vaccines?
Well, I don't want to be, I've not heard about that. But
sorry, just to jump in, that's a general situation coming from the WHO, not specifically in Nigeria. That's just a general situation.
Okay, because I know that in Nigeria there are programs laid down in order to maintain the cold chain of the vaccine that's been given out. I've taken my AstraZeneca shot and the cold chain was well maintained, and I can guarantee you the safety of the transportation because of the logistics that have been put in place. But still, if there are other places that has not been maintained, it's very, very dangerous, because that will reduce the efficacy of that vaccine, because the cold chain is very, very important in the preservation of what is made up of the content of the vaccine.
So I want to ask you, because very soon there are indications that to even travel, you will need your vaccine passport to get to other countries, show that you have been vaccinated. And this, people fear that this might lead to some level of desperation where people will make fake vaccine passports and people might take fake COVID-19 vaccines. What do you think are the stop gaps that we should put in place within the country to ensure that we do not have this situation?
Yeah, we are used to that in the country. I can cite, for instance, before we are using e-yellow passport, whereby you have your vaccination before you travel out to some countries that actually needed some things like that. The same thing is going to be applicable to COVID-19 vaccine. Now we have the passport, you have like a sticker that shows is original, you have your number that can be traced in the system. Don't forget that people have to register, input their bio data, then they generate a number, so that once they tested it and check in on the system, if truly you have been vaccinated, you have it. But don't forget that that's just an insinuation. There is no government that is coming out now that is saying emphatically that without the certificate for COVID-19, you cannot travel. What we are certain of now is only the test. Once you don't do the test, you can't board the flight. But that of the vaccine now, nobody is sure or are certain of that. Well, it may likely come up to that, but not of now, until a certain population of the populace has been covered in terms of vaccination, then we can be talking about that.
Medical virologist Kolawole Oladipo, thanks for talking to us.
Thank you.